Today we want to show you how we do IV sedation, or what typically happens at an IV sedation consultation with your dentist. Hey guys, Mo here, and we've got Kornelija and Vlad. So we know that a lot of patients have dental phobias. Nobody loves going to the dentist. So how do we make this as stress-free as possible for you? So one of the tools that we have in our toolkit is sedation. So we're going to go through it step by step today so that you know exactly what's going to happen when you get here, and that will help reduce your anxiety. So Kornelija has kindly agreed to be the patient here. So we're going to go through everything that typically happens. So the first thing that will happen is your dentist will go through your medical history. So asking you what medications you're on, about your general health, and that's going to happen at your consultation. The vast majority of patients are suitable for sedation, and we want to verify that and make sure that we are doing the absolute best thing for you. So we will measure your blood pressure, and on a machine like this, sometimes it's a lot smaller, and all that's happening is one of these inflatable cuffs is going over your arm. So this is really easy. There's no pain at all. It's just a blood pressure cuff that goes over your arm, and it will inflate. So you're going to feel a little bit of tightness on your hand for a moment. And often you can rotate your hand and just leave it relaxed. Your blood pressure will always be slightly higher at the dentist, no matter what. We call this white coat syndrome because you're at the dentist and you're afraid. You know, who isn't? So Kornelija's is like, you're bang on almost perfect. Ideally, it's like 120/80, and you see Kornelija's 119/77, so she's not afraid right now at all. So then we put one of these monitors on your finger, and that lets us know your heart rate, your pulse, and also your oxygen saturation, so how much and how well you're breathing. And we can see that Kornelija's resting heart rate right now is 90, and she's fully oxygenated, 98% oxygen. So it's actually falling there rapidly. I think you were a little nervous for a second, for whatever reason. Oh no, it's going back up again. Okay, so once we've done that, we're going to take this off. Now, depending on the type of surgical procedure you're having, this may stay on, and we will then put a plastic small cannula into the arm. To do that, we use a tight tourniquet. So we're going to take your hand here gently, Kornelija, and it's going to just come across here, and it's very, very tight on the arm. So really, really tight here, and often we'll give you also a little ball just to squeeze with. So can I have the alcohol? And then we're going to just disinfect the area that we're working on and use a tiny cannula. So you're going to feel a sharp scratch just for a little second, and then you feel nothing at all. It's actually pretty straightforward. We're going to take the tourniquet off. If you can give me some gauze, and then we're going to pop a little bit of gauze there, remove the introducer, and then close the tubing. So it's very, very easy. And then we're going to secure the cannula in position. This means that when you're sedated, even if you move your hand, because sometimes when you're asleep you can move your hand, that's totally normal. We use a bit of sticky tape like this. This is called Tegaderm, to keep the plastic tube in position. At this point, you can actually move your hand and nothing happens, because this is just, as I say, a very, very tiny piece of plastic in the arm, and it's totally harmless. At that point, we administer our medications through the top of the lid here, and you are totally relaxed, and often you don't remember even being at the dentist. So it's all very, very easy, no pain at all, nothing scary here at all, and we simply just peel this away when we're finished. And that's often the hardest part, just peeling away the plastic. If you have little hairs here, it can tickle a little. So if you're thinking of having sedation or wondering about the benefits of sedation for your dental appointment, just talk to your dentist and they'll go through this process with you.